We have 5 bigger hospitals, and what I term a bigger hospital is where we actually sit every day. 1 imaging center, and then the rest of them are smaller imaging centers / rural facilities in western Nebraska, Wyoming, and eastern Colorado. InteleOne, the actual implementation of InteleOne, we understood the product at that point, which helped out a lot. The process is very straightforward, and especially since we have relationships with our project manager and everybody now, it's pretty seamless. I mean, I think we make Intelerad's life a little bit easier, and then they make ours a little bit easier. So I expected it to not be as fluid as it is and to be as reliable as it is, as far as it retrieving priors and actually not impacting the radiologist's workflow, but in turn impacting it in a positive way. I remember driving home the first night that we went live, and this one simple fact that I had in my mind, I said it to myself like 4 times, it actually works. I mean, usually you get this, from salesmen and everybody else, you get this, rainbows and unicorns, this is how it's always going to work, but it actually really worked. It never was really oversold, which I was impressed with. Within 12 hours of implementation on the first day, we noticed an impact for the radiologist efficiency. That evening I actually got a call from a radiologist stating that he was going home on time or close to on time, and he simply said it works. Been a very stable product for us. It's improved the radiologist's day, made them more efficient, allowing them to read more, or allowing them to read the same amount in a shorter amount of time. Better quality of life for them. It's made everybody happier. How about that? It truly has. The radiologists do not complain about PACS in general. I mean, InteleOne's going to do one of 2 things for people. It's going to make them more efficient so they can read more studies, which is what we're experiencing right now. Or it's going to make them more efficient and they're not going to have to work as long. I guess it depends on what the practice or the radiologist wants to do, but it's going to do one of those 2 things for them, or both in our case. If we didn't have Intelerad, I'm not sure that we would have taken on the new business that we have over the last 2 years. It just would have been too cumbersome. It would have been too expensive to do as far as radiologists. But we are up about 200,000 exams a year up since the deployment of Intelerad. So I guess that would be a third that we grew. We truly did not expect for the master patient indexing to work as well as it does, and to have as much overlap as we've seen. It's changed. I like to say we're changing medical imaging healthcare in our coverage area, because we truly, having that ability to see priors across facilities that normally you would not know about is game changing, and especially with the direction that radiology is going, with, at least in the United States, the need to remove duplicate imaging, those type of things. It provides a great window that not many practices or systems have. Overall, the whole package of Intelerad is hands above any other vendor that we deal with.